Hello, Baltimore. It's Dr. Jeff Kalkstein with Dr. Adolf and Kalkstein, your Baltimore area chiropractor. And I have Warren with us for his second visit, right? Warren, you were in when? Last Friday?
Yes, I was in Friday.
First time, right?
Yes.
Yeah. And this is interesting too, because we see this happening all the time now. How were you referred to us?
Actually, it was just random from the internet.
Google?
Yeah, Google.
Yeah. Why'd you pick our office?
Honestly, because you were available.
Available.
I had to find somebody, and you guys were able to take me in.
So you called, and my office said, yes, we could get you in.
Yep.
So two things are unique there. Number one, he actually talked to a human being. And when did you call? Did you call Friday or Thursday?
I called Friday morning at about 9 o'clock. You guys said I could come in at 10.
At 10,
so.
Yeah, okay. So those are unique in this world. But Warren, more importantly, tell us a little bit about your situation.
I have lower back and hip problems. I've had both of them for on and off for about 10 years.
And do you have any pain down your leg at all?
Yes.
How far down does it go?
Sometimes all the way to my toes.
All the way to the toes, yeah. So tell everybody what you've done in the past for this.
Years ago, I went to a chiropractor.
Mm-hmm.
It didn't really help all that much, and then I kind of gave up, and then I kind of put up with it, and then I've been to physical therapy at one place, and I had basically doctors wanting to give me muscle relaxers and stuff like that.
And did any of that help very much?
Short term.
Short term. Okay. Good. And so when he came in last Friday, we examined him and we did a couple of just basic things. We dry needled, and then we adjusted you, right?
Yeah.
And how did you feel the next day?
I felt a little bruised from the needling. My back felt about the same. It didn't feel any different.
And then how about
Sunday or yesterday?
Yes.
It was incredible. I mean, I could stand up straight, and I could bend over, and I could walk and drive, and without it being, it was great.
Yeah. So what we're going to do is I'm just going to show you a little bit of the dry needling, and we're going to set it up, and I'll show you a little bit what we're doing, and then we'll cut it, and we'll come back into the adjustment. So before we go back in to see where we place the needles into Warren's low back and his hip, I thought this would be really helpful for everybody. This is an anatomical drawing of your muscular system. And so we picked up part of his gluteus maximus, part of his gluteus medius. Then we came over and picked up his piriformis. And then it's hard to see on here, but we have a couple in his multifidi and his quadratus lumborum on the right side. So I'll show you the pattern that we used on Warren, okay? Was that uncomfortable at all?
A couple of them were.
Yeah, and how did they were they uncomfortable?
They actually gave me like a
twitch?
Say like a sparking sensation going down my leg.
Okay, all right. So here's our pattern set up. We have the piriformis set up. We picked up part of his gluteus max, gluteus medius, quadratus lumborum, and then we have a little set up around his erector spinae, multifidi, and actually between the interspinous space between L5, S1, and L4-5. So now we're going to pull the needles, and then we'll take you over and show you how we adjust them, okay? Hello, Baltimore. We're back with Warren now. Warren's been dry needled, and we showed you the pattern we used. He also did low back exercises to start to strengthen his core, and now we're going to adjust his right sacroiliac joint. Here we go. And Warren, are you doing the exercises at home?
I didn't do enough of them
You
because
did.
I lost my sheet.
You lost your sheet.
Yeah.
Well, we'll make sure you get you
I got
sheet.
another one.
And that's like the dog ate my homework, right? We hear that every once in a while.
That's exactly what I said. I said I was a bad patient. I didn't do my homework.
You were non-compliant, huh? All right, so let that loose for me. There it is, on your back for me. So there's an adjustment for his right SI joint, or right sacroiliac joint. And now what I'd like to do is I'm going to do some long axis traction on his hip, okay? And we're going to do something called proprio-neurofacilitation. So what I want you to do for me is I want you to hike up your leg into your hip socket. So just pull it straight up. Remember that the other day? So go ahead. And so I'm putting a little pressure on there just to resist him. Now let go. Let go. No, relax. One more time. That's perfect, Warren. Good job. Now relax. Now we'll move over to the right side. Same thing, Warren. Go ahead, pull it up. That's the way. And now relax. Let it nice and loose. Let me draw it towards me a little bit. Relax. No, relax. Now pull it up. There we go. Much better control. Beautiful. Let go. And one more time. Draw it up. So I'm taking a little bit of long axis traction. He's drawing it up. And now relax for me. Let it go. There we go. Beautiful. Very good. So there you go. There's round 2 with Warren. Step off for me. How's that feel now?
Good.
Yeah, that's nice, isn't it? Yeah.
Mm-hmm.
So he's had this problem for 10 years or more, probably, right? And I went back and looked at some of his history, and he's had multiple MRIs. Any pain management at all? Any injections? Any steroid injections at all?
No.
No,
A
no.
bunch of, I mean, I had one regimen of steroids, just one time, because it had flared up where I couldn't walk.
An oral steroid.
Yeah.
All right. Anything else you want to share with our audience?
Not really.
Beautiful, good. Thanks, Baltimore.